Anytime we talk about medication used in psychiatry or mental health, at least you should know this. I say one, two, three, four, five. This is the five major one. This one. Five major classifications of the medications that we use in mental health. So please take note of it because anytime I ask this question, you should be able to know what are the medications, at least the five classes of medication you always see in mental health. There's no two ways about it. It's either patient comes in with this or comes in with that. So the first medication, oh, there's no two ways about it. You must know these medications, memorize it. It took me time. It took me time. It's constant practice. Okay. So the first class is antidepressants. I will still break the antidepressants down. Okay. So the first class is the antidepressant. So these are the medications that you use to treat people for that have depression. Okay. But most of the time in that antidepressant, we can also use it for people that have a, that is why when we talk about SSRI, we will still break down because we have like almost like four classes or five under the examples of antidepressant. One class is SSRI, another class is SNRI, another class is TCA, another class is MAOI. But like I said, we are still going to look at it because this is the slide here. So that is why I say there are five class, which is the atypical. So all these medications, they are all used for antidepressants. So under antidepressants, there are five classes under antidepressants. Okay, so the first class is your SSRI, the second one is your SNRI, third one is your TCA, MAOI, then you have your atypical antidepressant. So five. Okay. Then the next class is medication we call antipsychotic. So this is the one that we use for people that have a bipolar, people that have schizophrenia. And under that, we have two generations. So the typical. So that is my next slide. So which is my next slide. So the mood stabilizer, the antipsychotic, sorry, that is the first generation, second generation. Sometimes we may have a generation that is called partial dopamine agonist, okay, because this abilify can also be under second generation, but the only reason is that abilify, the other medication in the second generation can be sedative. It can cause sedation. It can cause a lot of metabolic effect. But Abilify, which is aprapazole, it doesn't cause it. So some book will tell you that Abilify is under second generation. Some other book will classify it under partial dopamine agonist because it doesn't cause sedation and it has a lower EPS. So that is your antipsychotic. Then the next class is your mood stabilizer. So this is your mood stabilizer, the one that controls the mood. So under the mood stabilizer, we have four medications: lithium, valproate, carbamazepine, and lamotrigine. Okay, so that is here. So that is it. That examples is these medications here under mood stabilizer. Then after that, we have another class of medication, which is the one that we call um, anxiolytic, the one you use for the management of anxiety. So under that, we have three, which is your benzodiazepine. And you know that benzodiazepine, we have other examples of benzodiazepine. I don't want to be listing it here, but we have other, because under benzodiazepine it also have Xanax, Ativan, Clonazepam, Valium. Then we have the next one, which is the Buspa. Buspa is another one under anxiolytic. Then the third one is a hydralazine. So that is why we have the anxiolytic and the medication for anxiety. Then the next one is the stimulants. Stimulants are the ones that we use for ADHD. So under this category, I want you to just call it ADHD medication. So we can break it down because we have stimulants and non-stimulants, because we have just call it medications for ADHD. So this is the medications with ADHD we use for the management of ADHD. Okay, so that is it. And under that, I broke it down again. Under medication for ADHD, we have stimulants and non-stimulants. So the stimulant is your Adderall, Ritalin, Vanish. Then the non-stimulants are your atorvastatin, which is your sertraline, guanfacine, and clonidine. Then we have under stimulants, we have two types: amphetamines and methylphenides methylphenidate. So this is your stimulant. Then we know the side effects of stimulant, but just know these classifications like we are breaking it down. Then after that, we have another one that we use for sedative or hypnotics, the one that makes patients sleep. Like I said, the major class is this one that is painted. I changed to yellow color, but the rest can be used is not really considered psych medication, but is also used is prescribed by psychiatrists. But it's also, for example, this sleeping medicines, zolpidem, Ambien. So you need a psychiatrist to write it, and most primary care doctor will not write it. Benzodiazepine. So, but these medications, these ones help you to sleep. Then we have other agents. So, like I said, these two are just an additional. So, these other agents, like beta blocker can be used for somebody that have like performance anxiety. There are some people that they can't really perform in the public of people. So, for them to perform, so we call that performance anxiety. So, we are going to use propanolol for them. Or sometimes they also use uh, NMDA modulators. So these are new medications too. We use it for depression. But what I want you to master right now is to master five categories. Whenever somebody asks you a question, what are the medications we use in mental health or psychiatry? Just do a fast rundown. Tell the person we have five classification. Under the five classification, we have the first or five groups. Let us call it groups or classification. Under the first group is antidepressant, and under antidepressant is broken down into also five: SSRI, SNRI, TCAs, and MAOIs, and atypical. And you should be able to know the names of some of these medication that is under the classes. Then the next one is antipsychotic. Antipsychotic is the one that we use for people that have bipolar, schizophrenia, and we say that we have a typical, which is the first generation, where you have your haloperidol or Hadol, and we have the second generation where you have your Respiridon and olanzapine. Then after that, we have another class. Another class is your mood stabilizer. So that is your mood stabilizer, the one that helps you with your mood. So the ones that are mood stabilizers are the lithium valproate or Depakote, carbamazepine, lamotrigine. Then after that, we have the one that we use for anxiety, to calm your anxiety, and the anxiety one is the benzodiazepine, buspirone, and hydrazine. Then the final one there is your like this one I said, the medication for ADHD. And under the ADHD, we say we have stimulants and non-stimulants. So, and finally is the other one, sedative, hypnotics, and other agents. I know that there is a video that I did that is thorough on all these classes of medications and how